We believe that faith in God gives meaning and purpose to human life, that the brotherhood of men transcends the sovereignty of nations, that economic justice can best be won by free men through free enterprise, that government should be of laws rather than of men, that Earth's great treasure lies in human personality, and service to humanity is the best work of life. We reaffirm our conviction that faith in God gives meaning and purpose to human life. May the Lord guide us in all our undertakings. To provide development opportunities that empower young people to create positive change. To be the leading global network of young, active citizens.
All right, good evening and welcome to our pilot episode of KGTV. So hello everyone, my name is Kitty Chukinhoy. I am the Executive Vice President for JCI Cagayan Gold. So for those that have been following us live sa amuhang Facebook lately, last January we actually did live selling via our KG pop-up store. So different ta karon, friends. Dili na ta karon na magpa-mine-mine, but rather we are here this evening to showcase members, guests, and because we love to do trainings, and this month is actually National Training Month for JCI Philippines, we will also have our first training for Motivate Plus this month. So we have a lot of things in store for you guys this evening. But before that, for those that don't know, sino si KG or what's KGTV about? So, but first of all, who is KG? So we are JCI Cagayan Gold. We are a JCI organization here in Cagayan de Oro. We are the only co-ed organization here in Cagayan de Oro. So JCI, okay, and this is our 33rd year. So we are KG fueled at 33. So we have been in the city providing service, doing trainings, and having memberships for 33 years already. And because we cannot be together, we thought of having a KGTV so that we could reach out to you guys and we can interact kahit virtually man lang siya, no? So to tell us more about KGTV, I'd like to introduce to everyone the 2021 local organization president for JCI Cagayan Gold, JCI David Piol.
Good evening, everyone. I am David, and I am the current local organization president of JCI Cagayan Gold. And tonight is a very remarkable night as we are launching KGTV. So KGTV, under the implementation of JCI Cagayan Gold, is an online talk show platform being shown or streamed on our FB page, which aims to give information about current events, most especially during this time of pandemic, no? And also to showcase outstanding individuals. So we will be inviting guests and that will showcase their skills and developments that they do to encourage the community, and most especially to showcase community programs which the local organization is implementing, which relay positive change to the community. So that's it, guys. So without further ado, this is KGTV.
Okay. Okay, all right. So thank you so much, Press David. So this is KGTV. So for this episode, our pilot episode, we will be having 3 segments. And so let's kick it off already. Our first segment, our member in focus. So watch.
I'm JCI Roxanne H. Fuentes, and I'm a member and past president of JCI Cagayan Gold. Thank you so much, KG, for inviting me to be part of the first ever KGTV live stream event. Happy Women's Month. This month is always an empowering month for women, and I'd like to share a little bit of my journey as an empowered woman, educator, and advocate. If you personally know me, you would know that I do a lot of things aside from being an education professional, mother, and wife, and I'm pretty much involved with a lot of organizations and advocacies ranging from education, financial literacy, critical thinking, and digital literacy. One of the advocacies that I'm very much passionate about is education technology and ICT in general. It was in 2014 when I was fully immersed and got to know more about STEM, science, technology, education, and math. And because I was also into research, I was always curious on how STEM helps students with their learning. So I began to explore ways on how I can integrate STEM concepts in my lesson and apply them in class. I got to learn about design thinking, creating educational video lessons, and even integrating engineering concepts in my English class. I post some of these ideas on my social accounts, and teachers began asking me how I'm doing it, and so that prompted me to create a website called thepublicschoolteacher.com and my YouTube channel, which has the same name, for the sole purpose of sharing ideas, video lessons, and anything under the sun. However, I felt that it was limited, and I wanted to explore and learn more and widen my horizon and the scope and the extent of reach that I have. The first community that I joined is the Google Educators group, and eventually I also joined other groups advocating for digital literacy and EdTech. Going back to empowering women, at that time, by being part of such groups, I was able to confirm that ICT and EdTech and the EdTech world was actually dominated by men. Even if teaching and education is generally dominated by women, but when it comes to this area in STEM and technology and EdTech, it is predominantly held by men. That actually led me to a realization that we need to empower more women and encourage them that they too can be in this field. So when I attended the first Women Tech Makers event in Cagayan de Oro and got to meet these amazing women in the field of STEM, I was truly inspired by them and how they are able to contribute to the community, and that encouraged me to become one as well. With my involvement, we began to train and create activities not only to teachers, but also to students and even those from other sectors, and show the beauty and amazing opportunities that ICT, EdTech, and digital literacy can provide us. These are all free events, and we're doing it voluntarily. And it's amazing that more women are attending our events, seminars, webinars, and activities all throughout the years. And these are all attributed to the dedication with all the people that I met and worked with. Personally, I also experienced new things such as being able to meet new people with the same aspirations, working with them, creating projects for some advocacies that we have. The network that I have went bigger. Plus, I get to travel locally and internationally through funding and scholarships. And I get to accomplish one of my goals to extend my reach and my influence. Even in my website and my YouTube channel, I see that some of the readers and audience that I have already come from all other parts of the world. And even if I don't earn from it, it drives me to do more because it's a manifestation that what I do helps people. And at home, I also apply the concepts and the beauty and the amazing things that EdTech and technology brought in, especially in terms of teaching my kid, my daughter, and help her improve her reading skills, writing skills, and all the skills that she needs to do to be able to become a productive member in the society in the future. Let us all remember that women can, women will, and because it's Women's Month, let me remind all women out there, let us be brave to conquer our fears, be productive, work our way to reach our goals, because behind every empowered woman is herself. Thank you.
There we have it. Women can and women will. Okay. Yes, thank you so much, PP Rocks. Women can and women will. Right. So we are celebrating Women's Month also for the month of March. And for JCI Philippines, we celebrate it through Pinay Power. And friends, I am very fortunate to have with us today our 2019 local organization president for JCI Cagayan Gold. And let me read this out correctly. The Education Program Specialist for Schools Management and Monitoring of DepEd Cagayan de Oro, JCI Roxanne Fuentes. So, mayang gabi, press. Mayang gabi. So, women can, women will.
And women will. Pinay power.
Yes. It's very unimpressed now. You were talking about IT and education technology. Is that edtech? That what you were referring to earlier? In my observation, Manggod, when you say something about IT or technology, it's usually male dominated. Am I correct? In my observation, it's usually male dominated. Is it true here sa local tato, like sa DepEd or even outside of DepEd's organizations, when you say about technology, the stigma is medyo pang lalaki siya, diba?
Yeah, that's true. That's true. Even when we were still studying no, in college, we would really see na more of those who are taking courses related to STEM, IT, and even engineering and math would more on men gid siya, more on the boys, no? And then siguro it's because of the culture na rin, and then back in the days kasi there's still stereotyping when it comes to our roles, no, as men and women. But yeah, in my experience, when I ventured into education technology, katong nag-explore na ko ato nga mga years, mga 7 to 6 years ago, I would really see that, no, na-confirm gina na ako nga in my involvement with organizations related to this field, medyo dominant gid ang male, even in the education sector. Pero pag when it comes to this area na, dagan jud kay siya men instead of women. But it's amazing because throughout the years, because na rin siguro pud sa mga initiatives and then the things that organizations and our institutions do to empower women, I think slowly gakadagan siya, kakakita na nako siya in the events and then in the activities that I attend and in the activities and the events that we do as well. So actually gakadagan na siya. There are initiatives like Women Tech Makers, Women Will. Actually, Women Will is a parang kuan siya marag subsidiary, and not really subsidiary. It's a group pod siya nga empowering women na gibuhat ni Google. So I see improvement in terms of involvement of women in this kind of field.
Press, why do you why did you favor, or why did you lean towards technology and in inculcating it sa imuhang role as an educator? What drew you to technology?
Well, when I transferred kasi in the public education sector, and at that time kasi it was just parang marag 2 years pa lang siya, or 1 year, 1 to 2, 3 years pa lang na implement ang K-12. And then ang nahitabo, there was a shift in terms of delivering our lessons. Like dito na introduce ang that time na introduce ang mother tongue. We use the mother tongue in delivering our lessons. So kato nga time, it was just my first year of teaching in the public schools. I really found it hard to look for materials in sinugbuan ng Binisaya, in the mother tongue. So mo na siya ginagsugod sa tanan. Then eventually, kung mulisod man gid siya pangitaon, nag-explore ko, and one of the things that I saw nga potential kaayo siya to create these materials is through technology. Kay ang ako manggong mindset ato nga time, if I cannot find it, if I cannot find it, then I should make it, di ba? And then mo rin tong time na nag-learn na din ko og edit og videos, I learned how to draw, I learned how to make ang first gali na ako nga educational videos before were stories in sinugbuan ng Binisaya nga stop motion lang siya kanang pictures na bitong nga mara dikit-dikit. And it was
Tagpi lang siya. Oh.
nagpi lang siya and it was just by the use of movie maker kay mura may mura dali ra
Daog-daog.
actually diha nagsugod no it still boils down to my passion for teaching and for helping our children learn the concepts, the lessons that they need to learn. So diha siya and then eventually naggrow na lang din siya from creating those educational videos and create na din ko website. I learned how to code and then right now I'm also I'm learning how to create apps and yeah, so ana siya marag na evolve lang gid siya all throughout the years. Nalim lang gid ko ana because of the reason lang yun nga mag-create lang yun og materials for appropriate and relevant for kids, especially now that they are digital natives. Dali ra gid sila mag-manipulate og gadgets and all. So yeah.
Yeah. Actually, it's very amazing, Press Rocks, because I was actually, I knew you when you started it already. So you would just share sa imuhang a page or sa imuhang website, and then I could see there were activity materials that the kids can actually use, no? And then I think it's quite timely also because you're one of the pioneers also. And then right now that everybody's going digital, you already have that edge na sa digital na field lugar siya na ano no. So thank you, and I think it's very amazing that it's a very good mindset. I think it's a very GCI mindset also. And if it's not available, then what are you gonna do about it? So correct, ba? Right? Yeah. So speaking of JCI, what sets JCI apart from your other involvements in organization and other tasks? Maybe you'd like to share it to our audience this afternoon or this evening, sorry.
Ang ginabuhat karon is like JCI gihapon, no? And actually, before this happened, I was already a member of JCI. Kay marag na-incline ko into technology ana mga digital literacy was in 2014. But I was a member already of JCI in 2012. So medyo naka-influence siya because yun nga, 'di ba, in JCI we always look for solutions. No, we see a problem, we see an issue, a concern that we face in our community, and we try to think and survey, assess, and think about what we can do for the community. It's the same thing with what we do as teachers, no, as education professionals. We see a problem in our classroom, then we think about what we would do. I think I was also influenced in some way with what we do in JCI dito sa ako kung ginabuhat sa akong career and profession. And what's nice about JCI is that di na ko na-learn ang kanag yung the correct process kay pag learn pud nako sa design thinking mura pud siya og JCI pud kanang mag-survey sa i-analyze ani mong problem, then mag-implement, then we involve stakeholders, and then we evaluate later on. So yeah, I think ma-reflect na ko. Oo, na di siya influence in a way.
Sa pae gid kaayo.
Yeah, true.
So for the audience lang, no, so sa PAE is when you enter JCI Cagayan Gold in particular, that's the first training that you undergo yun. So it's project planning, and sa PAE is survey, analyze, plan, act, and evaluate. So that's I understand, Press Rocks, no, na mula dito there's two or three kinds of person in the world, diba? One that sees what happened, one that waits for things to happen, and then one that makes things happen. And I think you're in the latter part of that spectrum. So yes, sa third na bracket, for lack of a better word na ano. Okay, Press, I think you already touched about it a little bit now, but how has JCI or your involvement or your being a member since 2012 added value to you in your other duties as a mother? Pinay power kay ta karon, no? So but you have so many hats, you wear so many hats. you're an educator, but at the same time, you're an innovator. You're a mother. You're a member of different organizations, and then I know right now you're also the one of the area officers for the entire Mindanao for publication naman for JCI. So many hats that you wear. How has JCI added value to your life?
Well, well, when I became a member, nag-start raman gyud siya nga kanang parang parang ano lang siya, parang an opportunity for me to break from the routine. Kay before man god nga wala kayo ko'y involvement. Marag school balay lang ko ba, ay trabaho, work, balay, trabaho, balay. And then when I became a member of JCI, parang there's something new all the time. I don't know if you experience that. Kanang mura bitawg na kay gina-look forward every Saturday, every Friday, back in the days, no? Back in the days, labi na tong single pa ko, nga pwede pa ko maglaag-laag, tagan, no? Tagan, o na-experience ko na tanan, then eventually naglaylo ko because I got pregnant, I got married, nag-adjust pa ko sa akong married life and all, nagkaguliyang pa sa akong pagbalance sa mga butang-butang. But eventually, I went back because again, parang naging routinary and I needed something new all the time. And I see that in JCI actually. Now, there's always something new. There's always something new to learn. There's always some people that you will meet from time to time. And you get to appreciate later on ang imong mga na-learn here in the organization nga. Ma-apply ra gyud nimo siya. Just like what I realize now nga, ma-apply ra gyud nimo siya ang imong mga nangatun-an diri. Ang mga struggles, ang mga challenges, ang mga conflicts, ang mga friendship na na-form din it always you appreciate it later on. Somehow it influenced you whether sa imong career or sa imong personal life. But then again, like I said earlier, ang ako yung pinakaganan diri kay there's always something new to look forward to. So maka-excite, dili boring ang life.
Right. So there's always a break from the usual na routine, and like you said, JCI, whatever we learn here, we can actually apply it to work. We apply it to our other organizations, our other tasks. So yes, I agree with you there, PP Rocks, no. And then of course you have always been a Pinay power mover for JCI Cagayan Gold and a very strong motivator. Thank you for accepting to be our member in focus for our first ever our pilot episode for KGTV, and I'd like to say a quick shout out to Press Mox of JCI Davao, and of course we have ITF Menen. Okay, so hello and good evening everyone. Okay, so we are in our pilot episode. We will have our grand launch of KGTV by April during our anniversary. Okay, so we also have NSG Steve. So nakulba na din ko. Undang na ta. Tense na ko. Stop na ta. Alright, so thank you so much. So thank you for joining us for our member in focus. So we will feature another member in focus. Okay, another member sa atong next episode. And I think lahat na po nang mag-host. Kaya give chance to others. Alright, so thank you so much, PP Rock. So women can and women will for Pinay Power. So welcome again everyone to KGTV. That was our first segment for our pilot episode. Now let me bring you to our golden feature. See what I did there? Awesome. Okay, so for our golden feature, this is part of our National Training Month kickoff naman, guys. Okay. So our next speaker is actually the technical sales advisor of All Tech's Philippine team. Okay, he is also our VP for Community for JCI Cagayan Gold 2021. Ladies and gentlemen, to talk about the One Health Initiative. And what is One Health Initiative all about? Is it all about humans? Is it all about animals? Because we've already been advocating for ASF and everything. So, ladies and gentlemen, I'd like to introduce to you JCI Grant Amoncho. May gabi, Doc. May gabi, Doc. Can you unmute your microphone?
Okay, hi.
All right, perfect. Sige, Doc. Go
Yeah.
ahead, Doc.
Okay, so thank you very much, EVP. And I think that means your go-ahead is a go-ahead of my presentation. So mayong gabi sa tanan, and wherever you are in the world, I know that we are here because we have this, pilot run of our JCI Cagayan Gold TV, and it's so challenging also, and trying to, to continue the enthusiasm of the first, members in focus nato na si PP Rocks from education and IT na field, and now let's a little bit shift towards conversation that matters, especially when it comes to health. And I'll be sharing with you the One Health Initiative and way forward. Basically, because I am part on the side of working with the animal health, and likewise considering that this world is not just all about animal health and animals, but this world is all about animals, humans, and the environment and everything that revolves around it. So basically, those really matters also on the side when it comes to working with and maintaining that health. And for this presentation, I'd like to start with the opening speech of the chief of World Health Organization, that we can only prevent future pandemics with an integrated One Health approach to public health, animal health, and the environment we share. Now is the time to take our partnership to a new level. And this meeting was last 27th of February. This was last 17th of February. And I'd like to bring that also aspect. And as part of the JCI Cagayan Gold, we would like to bring that aspect to the society, that we wanted to make sure that all our efforts are geared towards One Health, which means that we are taking consideration of the health of the animals, also the humans, and also with the environment. So basically, when we completed our degree, Doctor of Veterinary Medicine, we talk about subjects that matters with the animals, humans, environment, and everything that revolves and interconnects with that. So basically, when you are in veterinary medicine, you need to study also comparative medicine, and likewise, in that comparative medicine, you're able to touch human medicine. You also talk about social sciences and humanities, how people move, what are their perceptions, and at some point, how they move together with animals and the environment. And we have this engineering also that links between humans and the environment. And environment talks about earth sciences, environmental sciences, and there's that the equilibrium between the environment and the animals we call ecology, and basically study of the animals, and at some point any living things, biology. So we'd like to bring you to that aspect also. If you can still, if you have any idea, One Health has been moved by these following organizations globally. We have the FAO, or the Food Agriculture Organizations of the United Nations, and we have OIE also, or the World Organization for Animal Health, and the World Health Organization. So when we talk about COVID-19, the leading organization from the United Nations is the World Health Organization. But if pertains to a disease or coming from the animals, it will be led by OIE. And any conversation that matters most of the environment, the people, and also the animals, it will be this organization. We'll be talking also about this One Health doesn't just belong in one Sustainable Development Goals of the United Nations. This One Health approach covers all the Sustainable Development Goals set by the United Nations. Okay, So I'll draw you a little to the reality on what's happening now in our world. No, 60% of existing human infectious diseases are zoonotic. So unsa man ning zoonotic? Ang zoonotic pasabot ang sakit nagikan sa animals nga pwede niya matransmit ngadto sa tao and makakosa og sakit. And at least 75% of emerging infectious diseases of humans like Ebola, HIV, influenza, nagikan siya sa animals or in animal origin. And in every year, we have 5 new human diseases. 3 are of animal origin, so ingon pa sa OIE. But 80% of agents with potential bioterrorist use are zoonotic pathogens. So kung nakadimdum mo, it was maybe around year 2000s when you heard about anthrax. So I think you can still remember that one. So mahadlok ta mag-open og ato ang mga letter or envelopes or packages kay basin na ay mga anthrax dito nga gibutang, no? So those were the things that we will be talking about. And for now, I'd like to expound sa unsa ning zoonotic diseases. So unsa man di ay ni ang mga sakit nga nagikan sa animals nga pwedeng mapadulong sa tao o di kaha ang mga sakit sa tao nga pwedeng mahatag dito nato sa animals. But we'll focus few of those diseases nga relevant sa atoa. Okay? So maybe I'll just share with you na facts coming from CDC that each year around the world, it is estimated that zoonosis, or the one that diseases shared between people and animals, causes 2.5 billion cases of sickness and 2.7 million deaths. And that doesn't include the COVID-19 nga atong ginaatubang karon. So, unsaon ni nato pagpasabot unsa ni nang zoonosis diagram, no? So let's talk about, maybe let's consider first nga one health concern siya, for example, human. So ikaw mo kaon ka og lettuce, no? Kana nga lettuce gitanom duol sa adunay na ay cows nga gagraze. So gapupo ang mga cows, and it so happen that you use also the pupo of the cows or the manure of the cows as fertilizers. But you don't know kamusta ang health status sa animals. It seems that the cows are, still look healthy, but then there had been E. coli already, and then there's an increase or daghan kayong E. coli nga level, no? Escherichia coli. So what happens that kung naay E. coli, possible na serious illness or sometimes death can result, but basically it will, infect humans also. Okay, so maybe we'll check some of the information regarding that. But I'll draw you muna sa reality sa COVID, no? Disclaimer, the following resources that I pulled off are not the official yet, no, reasons why we do have COVID-19. Because if you can still remember, na headline siya within this week that it is just now, this week, that Beijing welcome or open its doors to international organization to study ngano nag-outbreak ta og COVID-19. So let's get back to the wildlife trade and diseases. Because at some point, na viral man to before, no? Last year nga nikaon og bat, so that's why naatay mga COVID-19 cases karon, no? Or maybe naay transmission between that. So firstly, let's talk about in wildlife trade and diseases, there's this what we call the animal-to-animal transmission, which means that some animals act as a reservoir host that carry disease-causing agent. It is either virus, bacteria, or parasite na pwede siya makatakod sa other animals. No? That's the first step. The second step, or the possible event, is the spillover event, which means that ang humans, ang tao, nakakuha sa sakit, pinaagi sa reservoir nga animal or intermediate host. Pasabot na ay in between. Kunyari, there's this baka, and then ang baka, yung sakit sa baka, ni padulong or na ay nag-reservoir niya, either rodents, and then si rodents dayon, naka-infect sa tao. So basically, si rodents, mo to ang reservoir host nato. No, naapoy ginatawag dayon nga, from that spillover event, there will this be human-to-human transmission. And that happened sa COVID-19 na to. Now, once the disease-causing agent has infected the first human, transmission gikan sa usa ka tawo padulong sa usa ka tawo na nadayoy possible nga sakit. No, basically that took place sa COVID-19. But again, I won't be saying na tinuod to or sakto to nga ang SARS-CoV-2 na to nagikan siya sa mga bats. Okay? Let's talk sa history. I'll bring you back to the history that diseases outbreak that link to wildlife trade. If naka-remember mo, in 2002, 2003, there's this ginatawag na SARS. No? So, SARS is the severe acute respiratory syndrome na coronavirus. So, identified live wildlife market in Guangzhou, China, which has, have human cases of around 8,000 and then 774 deaths. The origin is the trade of masked palm civets, also raccoon dogs and other mammals. And also avian influenza. No? When it comes to avian influenza H5N1, especially the avian influenza ng mga virus, dali ra kayo sila mag-mutate. And this is really such a concern para sa mga veterinarians nato and also human medical practitioners. And also sa scientists nato because dali ra kayo ang mutation. Mutation pasabot nga the first genetic makeup niya at some point na din siya insertion and then lahi na po dahil ihang dagway. So ingon ana ang I hope mapasabot na kog maayo sa Bisaya. And then we have in 2003, the monkeypox, first identified wild rodents from Ghana imported into the US for pet trade. Now this is really also important with the border control nato, especially, for example, kung ikaw Filipino, if I can still remember this one, when I arrived sa US, they will really ask you question. Like, naba kay chorizo, naba kay longganisa, naba kay ingon ani, naba kay ingon ana. It's because at some point, some of the viruses or causative agents, possible nga ni-thrive siya dito sa pagkaon ng imhang gidala. And everyone was talking about karon og African swine fever. And later, I'll explain deeper on that. Ebola virus. Kung naka-remember mo, it was in 2013-2016, first identified in West Africa, but in human cases, it gathered 28,000. And 11,000 deaths. Now, I'll just show you this one because this is one of the papers that I reviewed just in preparation for this talk or for sharing. Dili na nako ihaom pa dito nga grabe gid ka detalyado, pero this study na ako nakita, genomic characterization of epidemiology of 2019 novel coronavirus implication for virus origins and receptor binding. In short, asa di siya nagikan nganong na ay nCoV o nganong na ay SARS-CoV-2 na dayon. No, remember before last year it was still nCoV when wala pa gi-declare sa World Health Organization that it's SARS-CoV-2 ang causative agent. So dinhi tan-aw nato sa ako ang na share ninyo na screen with the red arrow. Kani nga mga cases were few of the first cases sa Wuhan district. And sa 7 ka representative, 2, 4, 6, 8, okay. Sa 9 ka representative ani, at some point 7 or 8, naa sila history ni bisita sila sa Wuhan market, sa marketplace, okay? The other one was, wala siya ni adto sa market, pero na siya sa hotel, nga doon sa market. Now, in conclusion, din na nato makita na maybe the SARS-CoV-2 or the nCoV before was not really coming from bats. Maybe it was coming from some other mammals and then ni-jump siya dito sa bats and then these bats muna dahil siya naka-infect. No? So possibly that there's still theory na maybe gikan siya sa pangolins. No? So when you look into din sa imbivovirus din sa ubos, basically those were pangolins and then naay mga bats. So in short, with this study, they have described that ang genomic structure of a 7th human coronavirus that can cause severe pneumonia and shed light to the origin and receptor binding. So in general, naay dako nga role si wildlife and also ang pag-uban ni wildlife nga gihimo nato through trade with that of the other mammals nga na dito. So nag-jump ang imuhang infection from the animals going to humans. Okay? So basically, spill over ang event niya into human population. So coming from then, December, and then January, February, March, and then officially nag-lockdown ta. Fast forward, napaghapon ta karon. Okay? So, those were really such a good presentation regarding sa COVID-19. So, din siya nagpasabot nga, if ang wildlife animals nato, ibilin lang nato sila sa wild, kad dito man gina sila gikan, o dito man gina sila napuyo, kung dili nato sila hilabtan, dili na makahatag og dakong problema sa atoa. Again, I'm just referring to this study because when you review also mga documentaries regarding COVID-19, there's still some who said that, COVID-19 came from a laboratory. So there had been biosafety issues nga na-break. Biosafety pasabot, inside the laboratory, possibly they inoculated or they created the virus and then ikawas. So again, those were still hearsay. There's no final genomic history yet nga nung naanatay SARS-CoV-2 or COVID-2 or COVID-19 nga sakit. Okay? So it is still not final. Pero importante, antay-bakuna karon. Next, another sakit niya, gusto na ko i-share sa inyo because this month is a rabies awareness month also. And did you know that rabies also is a public health issue? Nga naman, 99% of human cases results from dog bites, no? And usually, especially here sa Philippine setting nato, naatay mga iro bisan asa, no? So daghan galatagaw nga iro. And that gives us the concern nga kung ikaw responsible pet owner, why would you let your dogs nga mugawas lang dito diretso, wala nimo gihiktan o di kaha? Nganong ikaw kung responsible pet owner ka, why would you leave your dog nga dili nimo ginapakaon og sakto, dili nimo ginaputangan or ginahatagan og saktong balay, no? Did you know that one death every 9 minutes worldwide or a 59,000 deaths per year? When you go to YouTube and then you can click on rabies infection in humans, especially in the Philippines, you will really see a very morbid video there. Nagabula-bula ang baba because this rabies virus, the Lysa virus, will infect or will trigger activity dito sa imong central nervous system. No? So 4 out of 10 deaths are in children also. And in countries na affected, 150 countries worldwide, 90% of human deaths recorded in Asia and Africa. Na naman, una, it's because of our climate. Ikaduha, we really love dogs. No, ginapabayaan sa uban lang din sa gawas. So that's really a concern also. And 40% of the victims are children younger than 15 years old. And unsa may buhaton, no, para dili ta mapaakan. Ayaw og duuli diretso ang iro, kay especially sa mga iro karon or even sa mga iro pod, kana bitaw dili sila familiar pa sa imuha, kana kinahanglan nimo kuhaon ang ilahang loob. No, so ask before you pet or reach out to a dog. So ask muna other people if you want to grow or you want to live with a pet. And then at some point, walk at a normal pace or stand when a dog comes near you. Ayaw pagdagan. Now, I always remember this one. Even if naay iro din hawa kakailawa siya kaila nimo, ayaw dagan. Because kung mudagan ka, mudagan po siya. And to think, duhara imong tiil, upat ilhang tiil, so mas paspa sila. So, for sure, maabdad ka niya, mapaakan ka, no? Look after children playing with dogs also. No? Remember, again, it's better also na kung naamoy pets, kapon may mga bata, you really need to make sure na bantayan nimong bata. Problema sa mga bata, mga good, once nga mapaakan, dili is na sila usahay, because sa trauma nga napaakan sila, dili sila mo stories tinudon sinahitabo. No? And let dogs sniff or see you first before petting them. Keep calm, avoid making loud noises when approaching unfamiliar dogs, and do not disturb kung natulog ang mga iro, especially karon when you go to TikTok, they use pets as parang murag laughing matter or enjoy lang. And also do not encourage a dog to play aggressively. Ma-feel man na ninyo na murag bitaw over nagigayo gid ang akong pagkuan, over na kay reaction sa dog. Mo pangit tagali na ihang dagway. Ayaw nagdulai. Ayaw dulai sobra na maulit na sila. Again, ang atong brain o ang ilang brain pare-pareho ra, no? Pare-pareho nag-structure. Same as with us nga sungugon ta, masuko ta, ang kaya lang nato is manumbag, dili ta mamaak, no? So, And also, crawl into a ball when a dog knocked you over. Or sa ginaingon pa, kung naay mo dool nga iro, pakahoy-kahoy. Tindog lang din ha, steady lang ka. And also, remember, nga kani ang mga iro nato, kana bitawon si tawag, kalimot ko. They are really possessive at some point. If they know that ilahan ng area, ilahagi ng area, sila maghari din ha. Now, if nakasimot sila gikan ka sa lain nga iro, magmahay na sila, no? So raising awareness is essential when it comes to prevention sa dog bites, and also in making sure that there will be decrease in rabies cases here in the Philippines and even in our community. No, raising awareness because it is essential para ma-prevent ang dog bites, and also let's ensure prompt medical help. No, one thing also, especially sa general public karon nga naminaw, pag napaakan gali mo, ayaw magtuoan ng mukuha ko og bawang or garlic, moy ako ang i-juice, then moy akong akong ibutang sa samad, no? Again, guys, even if scratch lang na, even if gamay ra na ang paak, possibly nga ang kanang iro di ay rabid siya, you need to get a treatment also, no? Post exposure treatment, that's PET. Pero if you are into a lifestyle nga na naka-iro, or you will be exposed with the iro, so get some prophylactic PEP, no, PEP. And also to increase responsible dog and pet ownership, no? Again, we are in COVID, dapat sa mga community quarantines nato, at some point everyone thinks that I need to get a dog because I need to get a companion. No, get a dog if you're ready, and if you're ready to provide him shelter, food, and everything iyang kinahanglan. Again, it's not easy to provide those, but then the joy also of getting a dog is very, very special. No, so nindot kaayo ang kalipay ana. Moving forward sa next nato, and the last nga sakit na I'll be sharing with you is the African swine fever. And kinsa may wala pa nakadungog og African swine fever, especially here sa Cagayan de Oro, that we have cases now already of African swine fever. Why it is a food security threat? One, because majority of Filipinos, or pork still the major source of our protein, no? Ang baboy, 15 kilos or 15.07 kilograms ang per capita consumption nato sa Pilipinas. Ang problema lang ani is that before nag-African swine fever nga nato nga case, we have 12.5 million, or 65% of that is small scale. Now, I'd like you to draw your attention to the diagram we're in, because these are the ways nga ang infected animals can also be transmitted, or ang virus can be transmitted to the other farms. And here, just to give you a short recap lang, frozen meat or processed meats can be the source of infection also. Kay basin ang karning gigamit nila sa frozen meat or sa processed meat gikan sa infected na animals, no? And in a way to control African swine fever, especially here in the Philippines, what we need to do is that we have this 1-7-10 protocol, or di kaha in 1 kilometer, the first 500 meter, pag nanay confirm nga case, diretso depopulation, no? Just to share with you the timeline sa African swine fever, it started in Luzon in 2019, and last year in Mindanao, that's February, and then later towards the end of the year when we had the Iligan case, and then Cagayan de Oro, Misamis Oriental. And I'd like you to appreciate also the zoning map on this side, wherein kanang red mo ng infected zone and the green one are the free zone. So we need to protect the free zone, no? Here in northern Mindanao, we have free zones. Basically, what we are protecting is Bukidnon, because sila nga to ang producing province, and the eastern part of Misamis Oriental. So I hope that this message will be a good representation on how we get involved also with African swine fever, especially in as members sa community, that when ang hog raising gali nato mawala na sila, all other part of the agriculture sector will also suffer. Ang atong corn farmers, ang rice farmers, sugar farmers, o di ka ang atong mga meat vendors, meat shops, or even transportation. No. African swine fever is a food security threat, and likewise, it is a financial threat for everyone. And likewise, kung nanatay African swine fever, dili siya dali mawala, not until mo declare si Department of Agriculture there's no African swine fever virus already sa imuhang area, and then you can go. But then again, in Spain, they get back to swine raising or hog raising 30 years after sa ilang index case. Way forward, as we close, always wash your hands, no? If nihawid kag manok, nihawid kag baboy, nihawid kag anything, or gikan ka even sa merkado, nipalit ka og karne, nipalit ka og kanang gulay, always wash your hands right after, before sa imong next na activity. And then immediately contact health professionals, be it naapaakan ka sa rabies, or naay nangamatay nga baboy sa inyong silingan, nga dili mo sure kung unsay rason, or you can also talk to the health professionals, especially kung medyo na nakay-symptoms sa COVID, no? You need to work on that one. And then thirdly, vaccinate and judiciary use of antimicrobials or antibiotic. This is very important because pag naatay sakit or naisakit ang atong animals, immediately mo gamit din tao antibiotic. Antibiotic na na, gilantan, antibiotic na na. But the problem here in the Philippines is that pag naka sa city, when you go to pharmaceuticals, you can immediately, you can buy only antibiotics or antimicrobials with prescription. Pero pag naka sa mga munisipyo nato outside or outskirts of Cagayan de Oro or sa atong mga syudad, you can even buy diretso. The point is, when you do treatment, wait or give or get a consultation or the final instruction coming from your health professionals, and then get involved. Now, I'd like to end this presentation with how do we get involved also and how we move forward with JCI Cagayan Gold. Firstly, we have this Best for Our Pets. And we run this firstly before New Year so that we can, remind our pet owners that during these holidays, we need to plan for emergencies if na may emergencies sa inyong dogs. And then don't give them new human food and update health program. And likewise also, hopefully this month, we can run a program together with the local government units of Cagayan de Oro and the Department of Agriculture, supporting them sa ilahang Rabies Awareness Month, which is maging responsabling amo, huwag hayaang gumala ang alagang pusa at aso. And lastly, this was just a few of the many projects that we will be working with our key government agencies when it comes to African swine fever. So we are running the Save Our Swine, not because we wanted to save our swine, but we wanted to save the people who is in the swine industry, our farmers, our heroes, and also our food producers. Again, to close this presentation, One Health means there's this coordination, communication, and collaboration. People who protect humans, animal and health, environmental health, and other partners would work hand in hand to have a better One Health and to achieve the best health outcomes for people, animals, plants, and our environment. Daghang salamat ug maayong gabi sa tanan.
Ensure na na-digest na ko. Okay, Doc. So this is me trying to digest everything that you said. Thank you so much, VP Grant. Yeah, so One Health, when you showed the last slide there, it actually brought me back to social responsibility, also one of the foundational courses of JCI, so people, profit, planet. So here you have coordination. What was that? Coordination, collaboration, community, if I'm not mistaken. Yeah, so basically, Doc, correct me now if I'm wrong. One Health, what you're trying to say is that we're all interconnected. So just because it's a concern, for example, sa swine, like the African swine flu, it doesn't necessarily mean that it will not affect us as humans, correct?
Yes, that's right, EVP. Why it will affect us humans is because though African swine fever is not a zoonotic disease, again, dili siya makatakod sa tao. Naraka. Okay, so even if African swine fever is not zoonotic disease, again, dili siya zoonotic, pasabot, dili siya makatakod sa tao. So dapat walay panic ana. Ang mahitabo mong God is that even if it's not zoonotic disease, dili siya makatakod sa tao, it will be the tao who can bring that sakit dito sa ato ang mga uninfected na mga baboy. So what will happen? What will happen is that ang atong mga baboy will be affected, mamatay sila, or they will be subject for depopulation. So ubos na ang ato ang availability sa ato ang karne or sa atong karning baboy. Ang mahitabo po dani EVP is that mawad-an og panginabuhian ang atong mga farmers. So basically, if there's disruption in the economy, as we know, gabangon pa tagi kag COVID-19, napaning African swine fever, ang mahitabo ani is that luoy ang ato ang mga farmers. And everyone and everything interconnected ana sa agriculture sector will also be affected. Pag mahod na natagbaboy, which mo po nang nahitabo sa Luzon, naglisod na ta sa ato ang supply sa atong mga baboy dito, na nisaka po ang presyo, aside sa nisaka gyud ang production cost nato, it's because nisaka po ang ato ang mga production, atong mga raw materials globally. So, even if dili siya maka apekto sa tao, it will really affect us on the economic side. Pag mahod na natagbaboy, which mo po nang nahitabo sa Luzon, naglisod na ta sa ato ang supply sa atong mga baboy dito, na nisaka po ang presyo, aside sa nisaka gyud ang production cost nato, it's because nisaka po ang ato ang mga production, atong mga raw materials globally. So, even if dili siya maka apekto sa tao, it will really affect us on the economic side.
Okay. Thanks so much, Doc, for sharing with us African swine flu na so it's a major...
Pag na nagbaboy, mo po nang nahitabo sa Luzon, naglisod na ta sa ato ang supply sa atong mga baboy dito, na nisaka po ang presyo, aside sa nisaka gyud ang production cost nato, it's because...
Okay, so we're actually... The pressure is on, sorry. So we're live and we're experiencing technical difficulties. I really apologize to everybody. But the pressure is really high. I'd like to welcome to our show our National President, Ryan Ravanso. So he's also watching us. Mayang gabi, NP. Hello and good evening, NP. So thank you for joining us sa atong So yes, JCI Cagayan Gold actually adopted the Savor Swine. So it's also one of our program under the One Health Initiative, under the Office of the VP for Community. So that among other activities. So it's going to be a year-long activity nato. If I understand correctly, di ba VP Grant, na taas-taas gini ato ang agi karon sa One Health Initiative, specifically for ASF. Actually, ako kabalakan, wala na tayo bacon. Ha? Wala na tayo bacon.
That will definitely happen, EVP, if we won't protect our production areas, especially here in Region 10 that we are a producing region also. We are sending immediate, the market, our market, we are growing hogs towards Eastern Visayas and Manila and also locally. So we're protecting Bukidnon and we hope na ma-understand, no, it will be, the general public will join us also in this campaign. One, is basically don't let any new pigs arrive in your area. Second, don't purchase pork products or processed pork products coming from ASF affected areas. And thirdly, especially for our backyard racers, this time, if you still have a good, active na mga baboy or you have good pigs, then sell it immediately to the market now because the price is okay. If not, and if you will be affected, you will only get 2,000 pesos from the local government units as part of the identification fund, fee, and likewise 5,000 assistance from Department of Agriculture. Again, if you cannot sell those pigs pa because they're still young, I would really encourage do not feed them with pasaw or swill feeding. No,
yes,
basically because we don't know where those coming from, or maybe those were affected, especially Mang Tomas or any SARSA coming from affected areas, they might have a virus. So let's save our swine and let's save the swine farmers.
Correct, kaayo. So VP Grant, we'd like to ask everybody watching today, share the information, share awareness. Do not feed leftovers to our mga swine or sa pigs, because that's where the infection could come from. So you really have to purchase the feeds, especially if it's for your business, like if you're gonna do lechon and everything. So thank you so much, Doc Grant. And then dagan man kita gina-celebrate for March, so we're also celebrating Rabies Awareness Month. So it's Women's Month. It's National Training Month for JCI Philippines. And of course, meron palang Rabies Month. So thank you so much, Doc Grant, for sharing your expertise during our
Thank you very
Golden
much.
Teacher for our episode or for our pilot episode for KGTV. So thank you, kayo, Doc. And now, ladies and gentlemen, we have our final segment for this evening's KGTV pilot episode. I already mentioned we have Women's Month, we have National Training Month, we have Rabies Awareness Month, but also, friends, do we know that this month, March, is Fire Prevention Month? So we have our last guest for this evening, last but definitely not the least na guest. And ang kagwapo ani, Pinay Power pod kayo ni siya, kay Women's Month pod niya ang gidala niya. So guys, here is KG, know our guest. Okay, good evening, and ladies and gentlemen, I would like to introduce to you the Bureau of Fire Regional 10 from Bureau of Fire Regional Office 10, FO1 Angel Carbajal Ubalde. Very pretty, very
Hi.
beautiful. Our firefighter. He is also Women's Month, ma'am, no, with us. And
Yes. Hi,
yes.
Kitty.
Hello, may gabi kayo, ma'am. Salamat kayo for joining us this evening sa among pilot episode. Yes, ma'am, maybe you'd like to share with our viewers this evening because we're celebrating aside sa Women's Month. No? I'm so excited because when you say fireman, firefighter, automatically lalaki good na siya ang mag-come to mind.
Yes.
So I'm sure it's very refreshing to have you join us this evening. Yes. Ma'am, would you like to share something or what would you like to share about Fire Prevention Month this March 2021?
Yes, oo. To connect with what you said, no, yes, male-dominated yun ang ato ang uniformed personnel or uniformed organization as a whole in the government service. So, well enough karon nga generation empowered na kaayo ang atong mga women no sa Philippines. And so here we are, also being at par with men in the uniform service. Now, yes, Fire Prevention Month is the month of March as proclaimed in the Presidential Proclamation 115-A. So si Ferdinand Marcos ang nag-proclaim ani nga month to be Fire Prevention Month because based on series of fire incidents, ang month of March good ang pinakataas in a span of 1 year. Sa March good gataas ang ato ang incidents of fire. So all the more kami sa organization, sa agency, Bureau of Fire Protection nationwide, we push forth fire safety enforcement in the month of March through the observance of Fire Prevention Month. So this year, among theme, Miss Kitty, is sa pag-iwas sa sunog, hindi ka nag-iisa. So we are moving towards the Kaisa campaign where the BFP has somehow modified all our activities this month. Kasi 'di ba, pandemic, bawal ang mga gatherings. Dati mang good kay gabi among mga campaign outside, mag-gather sa mall, gabi ang mga events and all that. But karon we are leveraging on what's available to the public nga maka-connect gihapon ta. Like your KGTV, no, finding ways to really connect to your audience. So that's what we are also doing right now. And napod may mga lineup of activities where bisag pandemic na aghapoy presence ang atong BFP this month.
Okay, so when you say about these lineup of activities, you already started for March.
Yes.
So what activities
were already conducted, Miss Angel?
We had already done the kickoff. It's a signature 1st of March na activity where all of us in the whole Philippines, we do an on the road visibility sa tanan fire trucks, not only from the BFP alone but also to from our volunteers, partner organizations, yeah, even the non-government organizations, parada on the road. So we call it a kick-off ceremony. So we've had that last March 1. Nagtuyok ta din sa Cagayan de Oro, sa other parts of northern Mindanao as well. And then ongoing na pod ang atong mga regional arts competition sa whole region. So far, nagkandak na pod og mga poster making competition for students and digital arts for other civilians and also photo contest. So but basically, we are just moving towards what is available to the public right now. Nga dili necessarily mag-gather, but naagihapoy effort to promote fire prevention this month. Ongoing among mga OLP on the road, Oplan Ligtas na Pamayanan visibility. If mapansin nimo sila sa inyong mga barangay, no, padayon gyapon nila mga public addresses, ilahang mga safety reminders kada tagbalay. And then we also are doing OLP online. So sa Regional Office 10, we have a monthly BFP live campaign. Ayan, on the photos are the ongoing arts competition. Yes.
Okay.
So Anna, we are just
Sorry. Yeah, go ahead. Go ahead, Ms.
Yeah,
Angel.
so kana lang. We are still moving towards the half of the month. So ongoing gihapon ang ato ang campaigns for Fire Prevention Month.
Okay, thanks so much, Miss Angel. Actually, in JCI Cagayan Gold, we also wanted to adapt fire prevention month for this month of March. That's why we actually asked to invite you, because we want to use the KGTV platform kasi we can share it naman later, di ba, Miss Angel?
Yes.
And then always give this quick reminders or quick tips bitaw to our audience bitaw on what they should always remember and look out for. I think manggod di ba usually siguro nga naman gasunog yun usually or dako atong incidents sunog during March. Is it because of the heat? Because it's quite hot yun
Daghan
karon.
factors. That's one thing, and maybe because mupud ni siya ang time of the month na init jud kaayo, then people at home are not, let's just assume nga dili kaya na sila ka conscious. No, but based lang sa amo ang statistics, also sa among mga metrics, ang top 3 causes gyud sa atong fire as of last year, number 1 is electrical, secondly is kitchen fires, open flame fires, so these are common sa homes, and lastly rubbish fires or grass fire caused by lighted cigarette, kana bitang ilabay lang na cigarette butt na wala gipalong nga maka-cause og fire sa atong environment. So these are the 3 things that revolve the causes of fire most commonly. So for month of March, mo po ning tulo ka causes nga atong bantayan, labi na karon nga most of the people are at home doing online platforms, even sa school, no, atong mga gadgets, ang atong mga appliances always on.
Extension wire na on top of extension wire. Extension wire, guys.
That's one thing. And yes, and even if sige na nato ni gadunggan, balik-balik, no, tapos naagi hapon incidents of fire, maybe there's a gap na on how to apply it and really, be a leader on your own fire safety.
Yun. Thanks, Miss Angel. So, it's electrical, kitchen, and then this rubbish fire. So, sa electrical, guys, we are reminding everyone, Miss Angel is reminding everyone to unplug. Kung init na.
Yes, exactly.
Dapat
do not charge overnight also.
Do not charge overnight. Dili pwede extension wire patong sa another extension wire. What else should
Octopus wiring.
Is it,
substandard nga mga connections. Alam mo na yung mga wire tapping. Yeah, oo, kana. Imo mga appliances, substandard. So, there's a lot to what do they need to do electrical na maintenance is it
is there something like that? And you have to do electrical maintenance. You have to
Ideally, yes. It's one of the kung sa establishments pa no sa mga business related na building plans, naagid na sa ilahang commitment that they will have to commit for maintenance, electrical maintenance sa ilang establishment. All the more sa atong balay, although dili kaayo ni siya, I'm not sure if everyone applies it already. No, gina-encourage na nato karon sa atong Oplan Ligtas na pamayanan na even in the smallest unit of the community, we do fire exit plan, emergency plan, electrical maintenance check-up, even unsa kadako na imuhang balay, naadjud kay fire safety plan.
Fire exit plan and
everything na.
Each household should also have the extinguisher. Is it required?
Yes, it's encouraged already. Yes. Required. Dapat required din siya.
Encourage sa household. So
yeah,
guys, din naman na,
as much as possible, required na gid siya actually. Labi na sa mga balay.
Sa mga balay. Guys, it's for your own safety din naman. So fire extinguishers.
Basic lang.
Naman to yung mga handheld pod, ma'am, no, na mga extinguishers na ano. And then, ma'am, usually sa kitchen fire, I understand if it's a grease fire, mahadlok na din ko na part. If it's a grease fire, you can't take it out with water. Am I correct?
Yes. It's discouraged to buhos water there. Like, imububuan ng tubig. Kay, mo ano man siya mo, all the more siya mo flare up because of oxygen. So what we need to do is to starve it with oxygen. That's why we cover it, and then we shut the source of the fire. Say, the gas or the gas tank, we shut it off.
Okay.
We exhaust it with oxygen and shut it off.
Okay, so that's something to remember, good guys, especially for kitchen fires, grease fires. Do not buhos water kasi mas mudilaab siya. Okay? Because that's the common fire o tubigan gid basta fire, no. So get it has to be damp cloth or dili na necessary.
Yes, damp cloth.
Damp cloth
preferably.
Cover the fire.
Okay, so starve it from oxygen, and then you shut off the tank or the source of the gas or the diesel.
Ayaw mo dagan kay although
no.
Mudako ato ang fire, no.
Yes, but in the event nga di na gid siya ma-control, like ikaw as a household member, go to your exit na as planned.
Go to the exit plan. Yes.
Kaya dapat kahit sa bahay mo na agyud kay exit plan in case of any emergency. So
yes, guys. Especially if you have kids, you also have to tell our kids the exit plan. You have to inform them on what to do if ever it happens, no. So, Miss Ian, what about rubbish fire? Kasi these
that's another thing.
If I think about it, it's nothing intentional po, diba? You just thought na, sige, just my cigarette, but you left. You didn't even know na you were the cause of that fire. So, what do we tell the audience, or what is our quick reminder for them?
Kung mga rubbish fire, magod mo ni usually atong mga sunog, kung baga, munis la ang mga basura nga nasa kilid. There are occasions manggod nga naatay mga kapitbahay nga magsunog yun sa ilahang basura, which is bawal na siya. No, dili na to sunugo na ang basura in an open field, regardless kung asa imong location. So, reminders lang, let's avoid throwing anything that will ignite a fire. In other words. And then, if ever in the event nga nana ka sa area nga nag-start ng fire, if you can still find a way to put it out, like put it off, or kung nang palungon nimo by yourself, go. But again, if dili na gyud nimo ma-control, call your bumbero in the community. So, dapat kabalo pud ta sa hotline. Yes, so, sa inyong specific nga barangay. Yes po.
What's our hotline number?
Yeah, for CDO, let me get that. Atong Cagayan de Oro Fire District, na sila hotline number here. Wait. Let me get that, okay.
No worries.
So, kanang individual here, can we note that out? It's 0926 75 Yeah, 752-0623.
0623. Okay.
Okay, so that's
So
0926-752-0623. That's for Cagayan de Oro Fire District.
okay, guys, so it's on your screen right now. So take a screenshot. Appeal si Miss Angel sa screenshot. No, so you would know it's for Bureau of Fire in case you need anything. No, so yes,
Yes.
0926-752-0623. So last na lang, Miss Angel, because we also want to know you as our guest, because part of our
Mm-hmm.
segment is
Yeah,
really
sure.
know our guest. No, again, when we started the segment, I said na I don't really, or actually, you're the first firefighter na akong ilhan na bae. So,
Really? Sige.
so wala pagdinuang yun na,
Oo.
so I got very excited. So because we're also celebrating Women's Month,
Mm-hmm.
what led you to this career, and what would you like to tell our fellow women, and of course all our guests, maybe they'd like to join us join you guys
In
sa
the
Bureau,
service.
right? So you can also
Yes.
volunteer, diba?
Yes, of course. Okay, well, ako personally, Manggod, I'm a nurse by profession, so I'm also inclined with occupational health and safety. So at the start of my career, din hagid ko nag-start sa akong mga trainings, no? Di ba kay pag bago pa tag-work, hot kayo ta sa mga training and all. So din ako na inclined. And then as I've observed, no, what I'm doing in the company is also what the BFP does in the whole Philippines. So I thought with the opportunity that's available and with the help and support and influence of my family who are mostly in the Bureau of Fire also, Bureau of Fire Protection. So naaman good akong family inclined to uniform service. So nagka-opportunity nga makasulod. So it was really challenging, I should say, physical wise, emotionally, mentally, tanan, because you really have to isolate yourself from, you have to convert yourself from a civilian to a uniform personnel. In fact, we are really public servant, trained to be public servant. So we call ourselves lowest mammal, kung baga, sa
Yes,
training.
mama.
So
Bago na-
yeah, that's how we call our training start, no? And then eventually we are empowered to serve the public all the more with technical skills nga makatabang yun sa ato nga community. So for the women, wag kayong dili mo ma-discourage or ma-intimidate because admittedly hantud karon dominated pa gyud og men ang BFP. Although the opportunities are now equal and naanay level of ascertaining that all women have opportunities that men has in terms of benefits, trainings, exposures, etc. So kamo mga women nga gusto mag-join sa BFP, you have a place to start with here, especially if you are into promoting fire safety or you're promoting, educating people, reaching out to the community, even to the most like remote areas, makaabot yun mo diha. And then it just takes faith in yourself also, in yourselves, and kana bitang kabalo ka nga pag musulod ka, wala nang atrasan. That's a kind of yes.
yeah.
Yeah. Yes, kasi lisod man gud kayo makasulod, to be honest, with all the screening process and all that. So once you are given that slot in the quota, we call it, just make the most of it. We make the most of your item as a government employee in the BFP. Then tuloy-tuloy na yan. And masaya, lingaw gid kayo ang BFP.
Yun. So, and as a public servant, so it's a commitment, So I really
Yes.
appreciate, Ms. Angel, that you kept mentioning that you are really into service. Because JCI is also one of our tenets is service to humanity. Okay,
Yes, exactly.
yeah, I think it's also very aligned, sa imuhang
Very much.
values lugar that you're here for service, and that to be part of the service it needs commitment also. So thank you so much, Ms. Angel, for being our guest this evening. Thank you
Thank
for
you
sharing.
also, Kitty and JCI KGTV for having me.
Yes, it is our pilot episode, and we are making history. It's our first.
It's a privilege. Thank you so much.
You're our first guest for KGTV. So you're our Know Our Guest segment na ano. And yes, it's very a very opportune time because we're celebrating Women's Month again and Fire Prevention Month. So is there any final announcements you'd like to make to our audience? Reminders? Yes, go ahead, Miss Angel.
We just wanted to I just want to acknowledge again the support of our regional directors, Senior Superintendent Carlos Tenebro Duenas, for our current regional director for BFP 10. And just a message to the audience, padayon lang yun no, sa ato ang fire prevention activities at home. Be fire safety conscious all the time and i-embrace nato ang theme this year. Sa pag-iwas sa sunog, hindi ka nag-iisa. So marami tayo for the Kaisa campaign this month and the whole year forward. So thank you very much, JCI, KGTV, for having me.
Thank you so much, Miss Angel. So guys, hindi ka nag-iisa or hindi kayo nag-iisa. That goes for, that actually goes for everything. For fire prevention, for gender equality, for health. So hindi ka nag-iisa, we're all in this together. So that's basically
exactly.
Everything together. So daghan na kay kapug fans, Miss Angel, sa
mo ba? I'll check out. Wala ko nang check. Mag-shout out.
So later on,
wow. Hi, Maria. Thank you so much.
Yes, so we hope to be able to partner with Bureau of Fire later on for future activities.
Yes, of course.
We try to bring fire prevention to the homes. Good. So because we can't go to them, let's go digital. So we can start for this, for example, with KGTV. So thank you so much, Miss Angel. Once again, on behalf of
thank you also.
Gold. Yes.
Thank you very much. Thank you. And more power to your more shows in the coming days. We'll stay tuned. Thank you so much.
Thank you so much, Miss Angel. All right. So guys, for our pilot episode, we are now in 1 hour and 30 minutes. And I hope everyone is enjoying their evening this evening. Okay, so again, we just finished our episode sa Membership in Focus where we featured PP Roxanne. She was our 2019 local organization president, and she's actually one of the pioneers and innovators for education technology in DepEd Cagayan de Oro. And of course, we also featured our One Health initiative by VP Grant. Okay, so VP Grant is also with Alltech, the Philippine team or Philippine mission team. So basically, a message there is to make sure that you always sanitize in everything that you do, and everything is interconnected. So from animals to the community to humans. So we have to take care of one another. And of course, when Miss Angel mentioned about hindi ka nag-iisa, it goes for everything. Okay, so we are all in this together. So guys, in behalf of JCI Cagayan Gold, thank you so much for joining us, for enduring the 1 hour 30-minute show. Now, no, I hope you had fun. I hope it was informative. Okay, I hope you learned something and you take something from there. So siguro, okay, nag-parch na ko medyo, no? Ginapaundang na ko nila, no? Sa ako, my body's telling me na stop talking already. So once again, in behalf of JCI Cagayan Gold, thank you so much. We are celebrating our National Training Month, okay, with the theme Toklas, okay, a new shift of skills development paradigm. It's 2021 National Training Month theme. And of course, we started with our One Health initiative. We have Save Our Swine. And we will also have more activities in regards to Fire Prevention Month. Okay, so we will have our next episode soon. We will have one more episode before our grand launch on April. So stay tuned and please do like our FB page, JCI Cagayan Gold. So to everyone, stay safe, stay gold, and good evening. Bye! Salamat sa pag-join.